So I thought I'd do a little bit something different today and talk about lateral ankle sprains. This is a part one, and then we'll go on to possibly a part two or maybe a part three. Depends how much we get covered in each one. So one of the most commonest injuries in sport is the ankle, but we do sprain the ankles in health as well. And the problem is with the health side of it, we don't know really how many people do actually injure their ankles. A lot of it probably doesn't get reported on that side, so it's difficult to measure. So what's the reason for talking about these ankle sprains? Well, they can affect us a long time after the injury. So we know that people who don't get rehab, which is more on the health side, they can last for problems for many months to many years. And that, so getting the rehab early in there can be quite critical to restoring function, health, and have an effect on also psychological factors as well. So how does it all start? Well, the actual ankle injury is going to be when we roll over onto the outside of the edge and we go further than what we anticipated. There is some, if you want, flexion on that foot as well, or plantar flexion on there as well. So you've got ligaments that go across the ankle here, and they're the ones that usually get stretched or injured depending on the severity of the injury. So if we only get a very mild ankle sprain, then you tend to find that it might just be a stretching of the ligament there. So you might get a bit of pain and discomfort. Usually you don't see loads of swelling there. There might be a little bit in there. On the grade 2, it's when we get a lot more bruising all round the foot, a bit more of a ligament, might be a bit of tear on the ligament as well. And on the grade 3, as we go through, you might get a complete rupture of the ligament on there and a lot of swelling. So in grade 1, you can usually still walk, but you've got a little bit of a limp there possibly. Grade 2, you're really going to see a loss of range of motion as well, and it will affect your gait usually when you're trying to walk, so a lot of limping and that. In grade 3, where you're going to tear the ligament, you're going to be able to put any weight on it at all on there. So sometimes you'll see people go down the hospitals to have an x-ray depending on the severity of this, and there are some different tools that you can use, or rules like the Ottawa ankle rules, to try and help you assess that injury to that ankle. Now the problem is that there are risk factors to having these ankle sprains, and not all the risk factors are agreed with in different researchers. So I'll go through some that have come up before, and some will say definitely not, others say yes. So one of the biggest ones is any previous ankle injury. So if you sprained your ankle before, then it's more likely that you could get another one on there. But if you do wear a brace, now I'm not suggesting everyone should wear a brace once you've had an ankle injury. It depends on different sports. So a lot of sports people may tape up their ankle to give them more of a kind of stability type factor, but also a psychological factor if they've had an injury before, so that it can still play. Uneven surfaces is a big one, and together with the uneven surfaces, you've got to look at improper shoes. So if you're climbing a few mountains, do you want something like flip-flops on? Although we've seen this, so you're probably going to be a bigger risk then of actually having an injury from wearing flip-flops up a rocky path rather than wearing boots. Balance, that's always been shown in the research to be a factor of causing a few ankle sprains. And in some people, if they've got a lot of loose ligaments or stuff, so what we call joint anatomy, that's a possibility as well. But not, as I said, not all these risk factors are shown up in different research papers. So some say there will be risk factors, other research papers are saying like they've not found a risk. So it can be very different. The other one that comes up is hip and ankle strength as well. So that could be a possibility where weakness around the muscles in the lower leg or foot or further up at the hip. So you're going to lose stability in that motion when you move about. One of the research papers come up, and even the position that you play in sport could have more risks than other positions on there as well. So hopefully that will give you some of the reasons why we're looking at this ankle joint. So there's a lot of things that go into it. When we start looking at the rehab, you've got the initial treatment of the ice, and then you've got a lot more factors on rehab, which we'll go into on the part 2 and further on. The big problem we see is that people come into us when they've had an ankle injury perhaps a long time ago, and that's where some of the problems come. Maybe they've got a hip problem, knee problem now, but never related to how well the ankle was moving at the time. So that's the importance of kind of getting rehab for the ankle. Is it's going to affect other structures? Possibly. We can't say it is definitely. So, but if people do come in with knee and hip pain and they've had a previous ankle injury, it might be that we need to look at the ankle to see how well that moves and see how you walk or jog or run, depending on what you're doing, and seeing if that's having an impact or influence on the gait further up. So hopefully that's given you a little bit of information on the ankle sprain today, and we'll be back soon with part 2.